No motivation, no libido, no joy, no get up and go, feeling stressed all the time. All your lights are going out. Could it be your DHEA? Absolutely, it could be your DHEA because DHEA is your master hormone. It makes all your sex hormone, well, 90% of your sex hormones after menopause, your testosterone in men also, but more so in women, and estrogen. So when your DHEA levels are down, depleted, then you're going to feel like all your lights are going out because it affects every system of your body, your nervous system, your muscles and bones, your cardiovascular, your immune system. And so all of these things are affected. We're going to go into a little more detail about how they're affected. But in our conscious aging program, we take a combination of science and spirituality and put it together to make it the most vital aging process that we can. And a lot of times I get asked, should I take hormones? And my answer is usually probably not. It doesn't mean you never should take them, but when your body makes its own, it makes the right amount and the right kind at the right time. So why shouldn't we work towards helping our bodies function at its optimal rather than depending on a prescription and not changing our lifestyle that affects so many different things in our body? I'm Dr. Manon Fielding, and I've been a holistic practitioner for about 30 years now, and this is something that I really am passionate about, and I want to share this with you today. 6 proven strategies to increase your DHEA levels. And the first one only takes minutes a day, and it's actually the most effective one in terms of an individual strategy. So take a minute to like and subscribe if you like this kind of content, and we'll get started right now. A personal favorite of mine, which is the first one that I promise you only takes a few minutes a day, is called Heart-Brain Coherence. They did a study, the HeartMath program, that ran for about a month, and the participants had to practice at least once a day. So I don't know how many times they did or how long they did per day, but I know that they do teach that minutes a day do make changes in your body. This month-long study showed a mean 100% increase in the DHEA levels, which is really pretty extraordinary, and a 23% decline in cortisol levels. So when you're under chronic stress, this has a lot to do with the effect of chronic stress on our physiology and our psychology. It normally does increase our cortisol levels, and it does seem that the DHEA follows in the opposite direction, right? So if your cortisol goes down, your DHEA levels would normally go up, and if your DHEA go down, your cortisol levels usually go up. So that was published in the Integrative Physiological and Behavioral Science in 1998. That was pretty extraordinary. They also found some psychological benefits that were pretty interesting also, where there was reduced anxiety, they felt less guilt, a lot of what we call negative emotions, and a corresponding increase in caring, in compassion, in empathy. So this was a very interesting study, and it shows that we do have a lot more control over our physiology than we know sometimes. They also did a study in 2007 where they looked at mindfulness-based treatment. They also had an increase in the DHEA levels. So this is a very real effect. It's been duplicated in other studies. So being able to use this kind of strategy where it doesn't cost you anything, it only takes a few minutes a day, is really pretty profound, because the United States is actually one of the few places where you can buy DHEA off the shelf. And that is because what I explained earlier is that it's hard to dosage it. You could take too much and throw all your hormones out of whack, or you may not take enough and you think, oh, this isn't working for me. So being able to have this kind of control is great. So that's the first one. Also, I like the idea that it's available without a prescription, and you don't have to depend on anyone else except yourself to do it. Now, how do you do HeartMath? That is something that we teach in our program, and if you'd like more information, link is in the description. All right, let's take a look at the next one. You either love it or you hate it. Exercise, but not just any kind of exercise. It's really a certain type of exercise that has been proven to increase your DHEA. And that includes moderately vigorous aerobic exercise or resistance training. Of course, you can do both, but these are the ones that were tested. So one example study was with postmenopausal women doing 12 weeks of resistance training, and they saw a significant DHEA increase versus a sedentary control. So if you work at a desk job, you might need to move more during the day and then fit in a few times a week practicing one of these forms of exercise. So what is moderately vigorous exercise? It's the kind of exercise that raises your heart rate and your breathing, but you can still hold a conversation. So perhaps something such as brisk walking, hiking, recreational swimming, doubles tennis, and certain forms of dancing definitely fit this criteria. So it's an intensity level where you're working hard enough to feel it, but you're not completely out of breath. So if you're used to just going for a nice stroll and looking at nature, that's great, but that's not going to be the kind that will increase your DHEA. If you're not used to this kind of pace, just try starting in spurts and work up to a more consistent brisk pace. All right, that's number 2. Number 3 is about nutrition, but certain kind of nutrition. Healthy fats and balanced protein. What does that mean? Healthy fats are diets that are rich in monounsaturated fats. That includes olive oil, avocado, nuts, and when you eat a lot of that, it can raise your DHEA. So in women with type 2 diabetes, they did a study, 12 weeks on high monounsaturated fat diet. The DHEA increased, and the ones that were on a high carb diet, their DHEA fell. So the more of these kinds of fats that you eat, you not only will increase your DHEA, but you're going to lose weight, and it's actually going to help your sugar cravings to actually go down. So it's beneficial in many ways. So the more of these strategies we're talking about today, the less chance you're going to have of any hormonal imbalances or weight problems in the first place. Number 4 is related to the ones that we went over just a minute ago, and about eating too much sugar and refined carbs. So when you lower the sugar and refined carbs, especially if you're insulin resistant, you are going to improve your DHEA levels. So high insulin and blood sugar are directly linked to low DHEA. So in one study that was done in the Journal of Clinical Endocrinology in 2002, they found that weight loss in insulin-resistant women through reducing refined carbs improved the DHEA levels and other hormone markers. We actually cause a lot of our own problems, and I was just as guilty and was definitely a big carb eater. When I hit menopause, I started having cravings for chocolate, especially. And in those days, there was a whole big craze about how good chocolate was for you. But what they forgot to tell you, you could create insulin resistance, and even sometimes small amounts. It doesn't always take that much when you add up all the other carbs that you're eating. And there weren't as many different types of grains then. I didn't know about quinoa and things like that. This is a very important one, and just the weight loss in and of itself will help to improve your DHEA level, but this one was specifically involved with refined. Number 5 is another one of my favorite, because I've been using this herb for many years for other reasons, but ashwagandha has been shown to raise DHEA levels and lower cortisol in stressed adults. So similar to doing the heart-brain coherence, this herb does a similar thing. And this one study was a randomized double-blind trial, 60 days on ashwagandha root, increased DHEA by 13%. So that's not even as much as the heart-brain coherence, but maybe you can do them together. And it reduced perceived stress. So a lot of times it's not really the external stress that's causing the problem. It's our reaction to it, right? How it affects our physiology, how it affects our thoughts. So the ashwagandha actually helps with that. It helps your feeling of well-being. So you actually does change how you're thinking, and it affects the actual physiology. So I think that's pretty cool. I started taking it for an increasing anxiety, and I also had recommended it to a patient of mine who was having some mild depression. So it helps with depression and anxiety as long as they're not extreme. It does have some profound effect, and it can be taken long term. That's a good thing about it. Also, you only need 2 capsules a day when you start it, and if your symptoms are pretty severe, you might take 2 in the morning and 2 later on. But 2 a day is usually enough for most people in terms of the dosage that most of them come in. And I would recommend getting an organic brand and not getting them from countries or places that you're not sure if there's heavy metals, because that's one of the things that's a problem with a lot of our supplements these days, depending on where it comes from, is that it can contain heavy metals and other excipients, and that's not controlled. But if you do purchase them from reputable sources, then you know that they don't have that. Let's talk for a minute about when you might take DHEA. So let's say you've been dealing with this for a while. You have low libido, you're fatigued, and you possibly also have some issues maybe with bone density, mood, muscle mass, and it's a little bit out of control. Taking DHEA might be very helpful for you in that case. And I would start with a lower dose. You can always increase it, but like I said, if you take too much, you might have some unwanted side effects, which I'm going to go over in just a second. And also, if you have tested and you're really sure that your DHEA is significantly low. So the test that I recommend is the Dutch Complete. I think it's one of the best tests because it not only shows you which hormones are deficient or out of balance, it often can explain why. If it's an issue with sulfuration, for instance, or methylation, which is just a biochemical reaction, let's say that's not happening in your body, there's often a way that you can correct that and improve your hormone status in the process. And the Dutch Complete is the only test that I know of that does that. And that one is measuring urine and saliva, which shows your hormones over a longer period of time than a blood test. Now, blood tests aren't good or bad. They're just different because they measure one point in time, whereas some of these other tests are set up in a way that they're looking at more of a bigger picture kind of thing. All right, so that is when you should take DHEA. Now, some of the cons are what I was saying earlier, the side effects. Growing a beard, getting too much hair. It also goes along with acne, oily skin. Mood changes are some of the negatives that you might notice. It also can lower your good cholesterol, your HDL. That is one of the side effects. It also is one that you need to be careful of in terms of hormone-sensitive cancers. That includes your breast, prostate, endometrial. So if there's any hint of that genetically or in your family that you know of, you need to be careful about taking DHEA. And because supplements are so varied, like I mentioned earlier, you need to make sure if you are going to take it, that you're taking it from a reputable manufacturer, that what's in it is actually what they put on the label, because there is so much variation in quality on the DHEA supplements. The other thing is that if you're involved in any kind of competitive sports, DHEA is a banned hormone, and that is a good reason not to take it. And also, like I mentioned earlier, most of Europe and other countries require a prescription for DHEA. So these other strategies are things that you can do without a prescription. All right, so let's go over the last one. Number 6 is healthy sleep. We need adequate, consistent sleep to support our adrenal hormone balance, including DHEA. In one study of healthy young men, when they did some sleep restriction for 5 nights in a row, it significantly lowered their DHEA levels. That was in the Journal of Clinical Endocrinology and Metabolism. Many adults seem to think that you need less sleep as you get older, and that's probably because sleep can become more disturbed at our age, but that doesn't mean that we need less. Our bodies and mind need rest and repair. 7 to 9 hours a night is what is recommended. Without it, your DHEA master hormone system can become depleted, but if you develop good sleep habits, you can absolutely turn that around. Okay, so let's do a little summary so you can put this all together. There are a number of possible signs of low DHEA, and if you have 3 or more of these, you probably do have deficiency. Think about whole system, chronic stress related, and this is the list to consider. Low stress resilience, you feel wiped out after small stressors. Low motivation and drive, both physically and mentally. A lowered libido, you have lower desire, and your sexual responsiveness may be off as well. A flatness of your mood, where you have less joy, less enthusiasm, and less spark. And people might notice that and say something to you about it. Slower recovery, where after workouts or after an illness, it takes you longer to recover. Thinner skin, where you have a loss of elasticity and papery over time. And frequent infections because of the effect on the immune system and your general resilience. So if you have 3 or more of those, then focus on your lifestyle, on root causes, your stress, sleep, diet, movement, and definitely consider ashwagandha. That is really an amazing supplement for everyone, but only consider DHEA in specific cases with testing and monitoring. So assess on any of these new things that you try, assess how you feel in about 4 weeks. We don't recommend retesting for about 8 to 12 weeks when you start any new intervention. So if you haven't already done it, like and subscribe to Conscious Aging, where we help you reverse your biological age naturally with the help of science and spirituality. Have a fantastic day. Namaste.